Good evening, everyone. Um, April 9th, 2025. And I wanted to thank you for again joining us for another Managing Survivorship meeting. And we find out, getting a lot of feedback about how important this meeting is for a lot of people around the country. The first thing I'd like to do is let everybody know that today's meeting is very important, another important Managing Survivorship meeting, a topic that a lot of us are uncomfortable with. And what we do here is we do our very best to bring uncomfortable topics up to the forefront. So love, your mind matters, supporting your mental health during a prostate cancer journey. So first, what I'd like to do is always remember to thank one, those in attendance, the audience that's out there listening, but also our sponsors, Amgen, Bayer, the Dana-Farber Cancer Institute, which is our host organization, Exa, Alexis, Merck, Novartis, and Pfizer. And again, without them, without their support, we wouldn't be here today. Now, I always like when we're talking about a topic, give you some background information, give you some words that you'll hear, or vocabulary that you'll hear throughout the whole Managing Survivorship meeting. So these glossary words, mental health glossary words, this group, how do you feel? These are the words or vocabulary that you'll hear when you feel a certain way. So there's anxiety, a feeling of worry or fear about the future. Depression, a strong sense of sadness or loss of interest. Distress, emotional pain, upset, caused by stress, uncertainty, and fear. And then stigma, a negative attitude or judgment about a topic. Next, how to overcome these stressors, this anxiety, these problems. And we'll talk about coping strategies or methods of handling stress and difficult emotions. Also, mindfulness, staying focused on the present moment. And I say it again, mindfulness, staying focused on the present moment. And then cognitive behavioral therapy, CBT, a form of talk therapy. And then who can help? You have a psychologist, psychiatrist, support groups like PHEN, and also self-care. Now, I give you vocabulary words, but I also like to give you some science, some factual information to let you know that PHEN doesn't go to Dr. Google and search for stuff and try to put stuff together. This is research that was published in Cancer in 2023 that talked about depression in the prostate cancer patient. And what was important was there was depression found across all prostate cancer risk groups. And a large proportion of localized prostate cancer patients continue to experience long-term depression. And what they were saying is, at the end of this research, they were saying that patient-centric survivorship care strategies are needed. So we're showing you that there's a link between anxiety and depression and prostate cancer. And I want to take it a step further. There's more research that there's a direct relationship between even molecules that are produced by the body to help control the stress that allow cancers to escape the immune response. We won't talk about that right now, but we will move on to a very important area, the survivor. So first, I wanted to bring on Mr. Ray Fuller. He's in Georgia. He's an ambassador of PHEN. Ray?
Can you hear me?
Yes.
Okay. Good afternoon, everyone.
Good afternoon.
Good afternoon.
Boy, it's an honor, a pleasure to be here with Dr. Crawford, guests online, and the PHEN support group. Thank you, Dr. Crawford, for allowing me to share my journey with the prostate cancer.
And so I wanted to ask you,
Go ahead.
tell us how you felt when you were diagnosed with prostate cancer, and then what did you do? How did you handle, how did you cope with it? Was it
Well, when I was diagnosed with prostate cancer, I was sitting in my doctor's office, and he came in and he said, "Mr. Fuller, I have some good and bad news for you." Not knowing what he was going to say, he said, "I'll give you the good news first." He says, everything is all right with your vital signs and stuff like that. The bad thing is you have prostate cancer." Well, when I first heard that word cancer, immediately I thought death sentence. Well, he says, "Well, we're going to get you to go see some expert oncologists and let you decide what kind of treatment option you would like to have." It's my first time, dealing with prostate cancer. Never in my imagination that I thought I would come down with prostate cancer. Long story short, when I left there, I went straight to my church. And luckily, my pastor at that time was Pastor Borders, who is now bishop of the church. He said to me, he says, "Brother Fuller, how do you feel?" He says, "Are you afraid?" And when he said that to me, something just came over me while sitting in his office in church. And before I knew it, I was saying, "No, I'm not." He says, "Why?" I said, "Because I think my faith can help you overcome whatever. I left it just at that. I said, "Because if God brought me to this situation, I think he can take me through this situation." He says, "Wow, where did this come from?" I says, "Well, if it's gonna hinder my life and make my life short, if the uh, 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 if the treatments are there for me to survive, then so be it." Then he introduced me to Tom. He says, "Well, here is a group that I know that will help you along the way." And that's when I met Tom. But before that, he said to me, he says, "Well, you need to go down, talk to the deacons, and let them know what's going on with you and in cancer." So I said, "Oh, sure." And when I went to talk to them, you never know that what someone is going to say. And when you look around the room, you see all the expression on people's face. Oh, a death sentence. Lo and behold, but nobody said anything as to that effect of or how much time did they give you, and nothing of that sort. They just says, "We are here for you, Deacon Fuller." After that, I went over and I talked to Tom. Tom told me about the support meetings that were being held once a month. And I started participating. And after that, and each meeting that I attend, my faith got stronger. Now, I didn't know that there were someone in the hospital who could walk with me because no one told me that. All I knew was my faith, my faith. And that's where I am today. Whenever I talk about, excuse me, go ahead.
Thank you for that. I wanted to stop for a second. And there's research that clearly demonstrates and supports that positive attitude, faith, and not being in a depressive state helps overcome or helps you decrease the recurrence of cancers. And so I wanted to stop there, and then I wanted to bring on Mr. Fambles. Now, Mr. Fambles is also a PHEN ambassador, but he's out of Texas because we got to spread it around. So, Mr. Fambles?
Good afternoon, good evening. Llewellyn Fambles from
Good afternoon.
Longview, Texas. Can you hear me okay?
Yes, I can hear you.
I can almost ditto Mr. Fuller's story, but I have to take mine a little bit further. The day that I went in for my biopsy was a week after I had retired from the city of San Antonio. The very next week is when I received what I thought was a death sentence, that I had prostate cancer, but he said it was slow moving and slow growing and that I would die of something else before I died of prostate cancer. This was February of 2019. I would go every 6 months to get a PSA test, and those numbers seemed pretty small. In May of 2022, so 3 years after the diagnosis, I went in for an MRI. And 2 weeks later, I got COVID, and I got long COVID. So from June of 2020 through 2022 till April of 2023, I was battling COVID problems. So in May of 2023, I called the urologist back to see what the results were of the MRI that I'd had in 2022. And they said, we need you in here immediately. Somebody should have called you the very next week to get you in here because there have been changes since you had your last MRI. So I went in. My Gleason score when I was first diagnosed was a 6. When they did the biopsy this time, my Gleason was a 9. And my prostate was 5 times the size it should have been. So what he explained to me was the PSA test was being suppressed by the medications that I had been taking for the enlarged prostate. So in September of 2023, I had the robotic surgery to have the prostate removed. October of 2023, I started hormone therapy, Lupron. July of 2024, I did my radiation there in Boston with Brigham and Women, and was introduced to integrative medicine. So I would go to acupuncture and get massages. I did not use anyone like Mr. Joshua, who will come up later, but I did have a mental health counselor that I started with back right after my surgery. And I still go to her through Spring Health. But the health issue, the health part of that Mr. Foster first mentioned, you initially have this emotional response to the word cancer.
Yes.
But if you are a man of faith, you know God, and you know that God knows your name. And
That's right.
anything that God brings you to, he can bring you through. And so that's how I had to focus on it. And I still focus on it that way, even on the bad days. And I mean, some days are not good days, but I know that in the end, it's all in his hands. So we depend on the medicine, we depend on the research, we depend on a lot of those things, but we know that it's bigger than any of that. So, but what I want to highlight is I found PHEN the week before I had my surgery. And I have depended on PHEN, and I've worked with PHEN ever since then, because saving lives is a ministry. And
Yes, it
so
is.
PHEN doesn't call itself a ministry, but I call it a ministry because they are focused on saving lives. So
So
that's my journey.
So that was, you have two survivors, prostate cancer survivors. But each one of them tells us there is stress involved, but we have to find a way to manage the stress. Now, what's very interesting is this. I gave you some glossary words, right? And those glossary words spoke about a psychiatrist, a psychologist, but at a center like the Dana-Farber Cancer Institute, and Mr. Fambles talked about this integrative approach at providing care for a patient, there's someone who no one really knows about who is there for you. Not only there for you, but can be in the room with you if you have nobody else with you. And after you leave, that may, he or she may serve as your point person. So our speaker today is Mr. Joshua Ozar, okay? I'm gonna bring him up and introduce him to you. And then what we're gonna do today is he's gonna be at the podium and we're gonna talk about problems when it comes to mental health and how he can help you navigate, manage the emotional stress, identify stressors or ways of coping with this, and really help you get many people online, friends, even caregivers, that over that stigma that's associated with mental health and speaking with someone. Joshua?
Good to be here, and thank you so much for giving me the privilege of being able to be with all of you here today. Just by way of introduction, I'm a clinical oncology social worker here at Dana-Farber, where I work exclusively with patients in what we call our genitourinary cancer clinics here, which are primarily for cancer types. It's prostate, testicular, kidney, and excuse me, bladder cancer being kind of the largest pieces. And as social workers, we're often part of the front line of helping people connect with mental health treatment and providing counseling to patients while they're going through the experience of all the way from the diagnosis to getting treatment and what it means to enter survivorship. So real honor to be here. And I know Dr. Crawford and the team have prepared some questions as well. So I want to get to those too.
So what we want to do, the first category we want to focus on, I mentioned about this cultural impact. So that the first question is, how do cultural norms and perceptions of masculinity within inside a community influence mental health during the prostate cancer journey?
What I really appreciate about this question is it brings to the forefront this idea of how our culture and what's happening around us impacts how we're feeling. So when we think about masculinity and what it means to be a man and identify as male, it really does, there are some words that can come to mind, things like strength or, other just associations that we have with that concept. And prostate cancer is one of the many diseases that really strikes at the heart of, what many people come to understand it means to be a man. And also forces people to deal with or think about concepts like, and just hearing some of the stories shared earlier, concepts of mortality and what it might mean to be sick. And these are things that can clash with some of what we hold up in society as, norms of masculinity. And so that can really, and also not just societal norms, but also our own self-image of ourselves as men. And so when you introduce a disease like prostate cancer that is both, an illness and impacts parts of the body that, really help to orient and define what it means to be a man in our society, that is a very difficult experience for many patients.
So we've identified this problem, not a problem, but the concept of masculinity and cancer. How do you get men to overcome that? How do you support them?
You know, many times with mental health and with concerns. So one of the hardest pieces is the isolation. And I don't know for those in the room or those on the Zoom link as well, but I, can hear from patients, and not just with prostate cancer, but with prostate cancer as well, the feeling of going through this alone, or feeling like, just how isolating it can be to feel sick or be diagnosed with the disease. And so many times just feeling a part of the community, and feeling supported by other people can make such a big difference. I think in addition to that, it's really trying to work with people. And one of the therapy techniques you talked about in your introduction in the glossary of terms was this concept of cognitive behavioral therapy. At the core of the idea of cognitive behavioral therapy and what mental health professionals are trying to do with people and with patients is to try to say, we understand, or you might understand yourself to have a conception of what it means to be a man, what it means to be somebody who's well, and to try to work with people to, in a safe way, kind of challenge that belief and say, well, gosh, is having a prostate, how important is that to who I am? How important is it to me to have, some of these body parts or functionality, and trying to help people understand, there are also other parts of life or other things, and acknowledge at the same time the real loss. I think part of that, a lot of the experience that comes with a cancer diagnosis is that feeling of loss.
Mm-hmm. So how do you, when you're talking about this loss, we're talking about anxiety, we're talking about depression. How do you help people successfully navigate this, cope with these? Do you have any strategies that men could use?
It's wonderful. I think one of the main things in our social work training, and when we talked about there are psychiatrists, psychologists, and other mental health professionals involved as well that people can see. But in social work, we're often really focused on not just kind of mental health, what's happening between people's ears, but also how they're interacting with their community, how they're interacting with the people around them, understanding that mental health is social health, and that isolation or losing that social health can be really difficult and exacerbate or make worse the experience of cancer. So oftentimes, one of the biggest challenges of getting a cancer diagnosis and going through this is that, particularly for people who are going through treatment, losing activities or relationships or other things that make them feel good, make us feel good as humans, make us feel alive. And many times mental health struggles originate with the idea of losing something that connects us to life, connects us to feeling good. And when we lose a part of that, it's sort of, I think, a very intuitive thought or an intuitive idea that if we can't do the things that make us feel good in life,
Mm-hmm.
that's going to have an impact on our mental health and our stress and anxiety levels. And it's trying to even just coming with a recognition of what that is and what that experience is like can sometimes really help free people from some of the side effects.
So there's something that was mentioned before. So we talked about cultural impact and masculinity. and a feeling of loss of masculinity. But there's another thing, this topic that comes up, and this is whole stigma. Let's say before we even get to masculinity, this whole stigma about mental health and dealing with the mental health professional. What would you say, or what do you do to help change or help address that stigma in patients that you see?
I think one of the things that has happened over the last 20 or 30 years that is a positive trend in some ways is the medicalization of mental health care, which means that, more and more we've defined and diagnosed people with things like anxiety, depression, other conditions. And I think one of the trade-offs of us talking about mental health in more medical terms is that there are so many informal ways people support their mental health that can, be lost in that. So one of the things that I really focus on, and as I'm describing my role with people and patients here, is that typically what I offer is counseling. That's how I describe it. There are a lot of other ways to get counseling. I know some of the survivors that spoke earlier talked about the idea of, getting some of that counseling at church. Our clergy and there are spiritual care team members here at Dana-Farber, for example. Many hospitals and other settings have them as well. But many spiritual leaders, clergy, are trained in counseling. They're trained to offer support. So there are, wonderful mental health professionals like those that you talked about, but there's peer support, there's getting counseling and support groups, there's talking to clergy. So I think what I try really hard to do with patients is to break the barrier of, this is a clinical mental health encounter, and try to lower the bar to, this is a conversation about how to best support you during treatment. And that doesn't necessarily have to be with someone like me or someone like a psychologist, but that can be with a friend. It can be with a support group. It can be in a lot of different places. That many people find just talking with someone, can really break down a lot of barriers.
And it's interesting. An oncology social worker, and not a lot of people know that. And I take it that, are they knocking your door down, or and know that you exist? And what kind of message would a oncology social worker have to bring more and more prostate cancer patients? So there's a difference, because there are publications that state that men, in this case, are more likely to take pharmacological drugs treatments than to see a therapist or to talk to somebody. So what would you say to the here and online about coming to see someone, asking about you? What would you say to them?
I think, first of all, many of our oncology medical providers here at Dana-Farber, but at many other medical centers too, they want to be able to talk about mental health in medical visits. Many providers will ask how patients are doing emotionally during visits, but with the acknowledgement that those visits are often quite short, and there isn't always a lot of time to get to how people are feeling and how people are kind of coping emotionally. Many times there is, and we get patients who do come to us directly, kind of seeking support. But a lot of times, it might be that they mention something to their doctor, or they mention something during radiation treatment, just a concern about how they're feeling. And a provider will, bring up the idea of, oh, have you considered talking to somebody? We might have somebody here at, and I'm speaking now more broadly beyond Dana-Farber, but we might have somebody here at our hospital who can talk to you. We might have, or be able to recommend to other providers elsewhere. So we do rely a lot on the people that are meeting every patient to help bring people through the door. But there is a lot of value, and I think people should feel empowered to let their medical providers know if they're struggling and what those struggles are. You know, the oncology teams are trained to help assess and make recommendations on where to go, people to talk to. And you know, we're part of that. Some of the other professionals that were mentioned can also be a part of that. But it's also okay to say to you know, a provider or really other people in the medical environment that you're working in that you know, I'm having a hard time, and I think I would really benefit from talking with somebody. And depending on where you are and the types of, you know, supports that are around there, people will make recommendations. And so there are a lot of ways in, but it does start with, you know, feeling hopefully comfortable talking about this with someone.
Yeah,
you know.
and hopefully, and this is why this session was so important. First, we want to pull the curtain back and talk about a topic that has the stigmas associated with it, and then bring in a person who is an expert, not just a social worker, but a oncology social worker. So what's interesting is this: the Dana-Farber Cancer Institute provides kind of this integrative service. Now, a lot of people across the country may not have access to a top tier cancer center like the Dana-Farber. How would they seek out and identify someone to help, someone to talk to? Because Mr. Fambles was able to find someone in Texas, but what resources are available for everyone to start or to find someone to talk with?
Yeah. So I would always recommend primary care providers are not only for physical health, but also for mental health. We view in primary care offices as sort of the front line of helping people who are struggling emotionally. You know, almost everyone at, you know, above a certain age sees a primary care provider regularly, and it can be difficult to have time in that visit to talk about, you know, kind of emotional, but sometimes people will have a survey they might ask before a visit, asking how you're doing emotionally, and ask some questions, and to feel empowered to, yeah, answer those surveys honestly, to talk about this with the primary care provider. And they will be able to give some advice on local resources usually. But in addition to that, there are some wonderful prostate cancer specific organizations that make a point of helping connect people with supports. One of the ones that I've had a lot of success navigating from a resource perspective, and had a lot of, just if you check out their website and helpline can be very helpful in this regard, is the Zero Prostate Cancer, zerocancer.org. They're have a kind of business hours helpline. And they also have, you know, ways to be in touch with them in other ways, but an excellent resources on the mental health experience during prostate cancer, and can be a really nice way to, you know, connect with a provider.
Mhm.
And that's just to mention, there are also other, you know, the Prostate Cancer Foundation and other organizations nationally that are support organizations, you know, and can help people connect with someone and understand some of the mental health challenges with this particular cancer type. More specifically.
Yeah, so because those organizations use the same similar approach that we use, and that way we have relationship throughout different states, and that use that network to kind of reach out. That's why we have our ambassador program, because that's our touch point. That's the patient-centric approach. Because what we recognize is this topic is very difficult, and when you have knowledgeable prostate cancer survivors who are ambassadors, who introduce the topic, who come in and say, how are you feeling? Because what we find is that you ask a large percentage of people who have prostate cancer, has someone offered it? They're not saying Yes. Now they've offered a lot of different care, treatment options, but no one's even, I think, and that's a question that I have. Do you find that clinicians may find it difficult to raise the topic of mental health to their patient because of the stigma?
I think it is difficult. And you're right, it can't come up in every visit. And it is a challenge. Overcoming the stigma in these settings in general is a challenge. But I think one of the things that is usually clinicians and mental health providers are also kind of keyed into is looking for what we would call, just like medical professionals, is thinking about, well, what are risk factors for mental health concerns? Some of the ones that clinicians and others are keeping an eye out for are, significant changes in quality of life.
So that's important. Depression, mental health, and quality of life. And let's say it again,
Quality of
depression,
life. Yeah.
anxiety, and negatively impacting quality of life.
So when clinicians and others are seeing big changes in quality of life, big stressors in people's life, in addition to the cancer, the loss of a loved one, the experience of, challenges with other resources, getting access to food or having issues with housing. These are things that, clinicians are keeping an eye out for and are sometimes risk factors for people feeling under a lot of stress. And so using that also as a way to help, bring this issue up with people who might be in situations and struggling.
And then hopefully programs like that we offer and during our Managing Survivorship kind of peel back, open the door. It's all right to talk about this. So that's why we felt that this topic was very important, because it's not a topic that's brought up by clinicians, and the fact that you're not even known. A treasured commodity at the Dana-Farber Cancer Institute, someone who has the ability not to sit across from the desk, but if you were alone, you would go to, and correct me if I'm wrong, you would join the patient, sit with the patient, and listen to what the doctor is saying to help the patient better understand what they're going through. Am I about right?
Yeah, so there are certainly circumstances where we will join, and this is true in a lot of other settings as well, where social workers might join a medical visit with a patient, and there can be different reasons for that. Oftentimes if the visit might be particularly emotionally challenging, and it's usually at the request of a patient or a provider. So it's not usually every visit, but it is to know that there are supports around to help process. Even hearing some of the experiences that were shared earlier in the call, just how when we are receiving news in these medical visits, stress levels can go up. It makes it more difficult to key in or to focus on what is being said in the room. Particularly for people who are alone or single or presenting without support, we do try to be cognizant of and accommodating to people who are sort of going into some of these medical visits alone, like you were saying, because it is so difficult to process everything that's happening and the information that's come.
Okay. So what I wanted to do is take this point and then open the mic up to online. If people have questions, they can type in. And if you're more comfortable making your name anonymous, just make your name anonymous on the Zoom. So we don't, to avoid, because we still address the stigma and people may be uncomfortable with it. But so you can make yourself anonymous. But also, are there any questions that we have from the audience here or from online? Well, there was one that came up. It goes back to, I mean, to what advice do you have for those who are hesitant to seek help due to cultural or personal beliefs?
I so appreciate that question. And I think the first thing I would say is, as much as it is, and I would encourage people to reach out, it's also okay to know for yourself and for somebody else that if it's not the right time or you're not feeling comfortable, then it's not the right time. That's okay too. So this is a bit of a balance, but trying to acknowledge both at the same time, the idea that it's okay to not feel ready. My encouragement would be for people who are maybe not feeling quite ready yet to reach out to a professional is to reach out to other people in their lives who might be willing to talk about this with them. So even just opening a conversation as part of a group like this, or with just a trusted loved one, a trusted, like we were talking about before, a trusted spiritual leader. These can be places to have these conversations. And then I would say if people start to feel like talking about it helps, then that can help, maybe open the door for more of a conversation with a professional as well.
Okay. We have someone in the room.
Yes, my question is, when you have when you're married or not married, but coming in to talk about relationships occurring and the things in the relationship is still ongoing. You don't often go to a psychologist or someone else or marriage counselor because of the thing you talked about earlier, masculinity or whatever. It's not to be afraid to talk about these things or not being able to have sex, but there are other things that are going on in life. So often we never talk about what happens when you do get prostate cancer and the body parts aren't functioning anymore like they used to.
That prominent question for me brings up one of the things that when we are working with couples and families is to think about couples and groups as a system that are working together. And when a part of that system changes, it impacts not just that one person, but it impacts other people too. And so we do, and this is something that hasn't come up yet in the conversation, but many of us, the mental health professionals that are trained here and the ones on the list that was provided, many will be willing to meet with couples together. If that's what, say, for example, a patient is looking for, is to meet together as a couple and talk about some of the challenges as a group together that are presenting because of the prostate cancer. That's something that a lot of providers are willing to do. But it is, and the benefit of having a counselor or a therapist involved in that circumstance can be to help have just a neutral party who can help guide what is otherwise a really difficult conversation to have, for people on their own. So, but it is, it's also okay. There's both the opportunity to talk as a couple and there's an opportunity to talk as an individual about being a couple. I do find and do work with individuals during sessions and during time together on the sexual impacts of prostate cancer, and having a place to talk about both what they're likely to experience during treatment and what they're experiencing after treatment. And just having, again, a place to be able to speak about that with someone who knows these cancers well and understand some of the challenges can be helpful.
Now, that was very important. I just wanted to clarify this. So I have a question that really dovetails into exactly what you talked about. So you were talking about men and their partner, but remember, we're talking about a couple's disease. So the caregiver or the partner, do they ever talk to you about how they're feeling? So we reversed it. So we took the prostate cancer patient survivor out of the room. Now the caregiver, the partner, the wife, spouse. Do you talk to them?
It's a excellent question. This is something that will be a bit different depending on the setting and the particular hospital. In my experience, it's not uncommon at all, particularly when people are coming together. When I get a request from a caregiver or a partner or someone close, a family member, for some support, there are some, I would describe it as like desire to make sure that providing that support is both okay with the patient and with the broader idea that ultimately, as an oncology social worker and as part of the member of the oncology team, our first responsibility is really to the patient. But I do spend a lot of time helping caregivers and partners also connect with resources. So becoming familiar with, there are not just for prostate cancer, but for many other diseases. For partners, there's a caregiver support group, for example, here at Dana-Farber that's offered, and many other organizations have kind of caregiver or partner support groups, and to help get people connected with things like that as well, other resources that can help be a support, because it is, it impacts families really, really.
So I think that was very important. So there's a clear takeaway here, and that is there is the impact of prostate cancer on the mental health of the patient, the mental health of the caregiver. And that's a topic that really not a lot of people talk about. So that was important. I have a person that has a question.
Yeah, of course.
Yes, thank you very much for your discussion with us this evening. I have a question. We all as survivors have issues that we have to face. And these issues are ongoing. They change from time to time, from when you first diagnosed all the way through your journey. What are some of the most common issues that you deal with? And do you find those issues different for, let's say, between Black men and white men?
Yeah, great question. Probably the most common challenge that is seen in this setting and with cancer patients in general from a mental health perspective is something that we label adjustment, which is effectively coping with and getting comfortable with the idea of change, potentially a big change in, like we were saying, things like sexual functioning, change in relationships, change in just the routine of life associated with having to come in every day for radiation, having to get surgery. These are really life-changing experiences. And just many people, both in cancer care and elsewhere, experience some challenges kind of getting settled while going through something like that. So that's, I would say, probably the largest challenge that people face. There are many others, some of the research that Dr. Crawford presented earlier around people who are in cancer treatment generally, but in prostate cancer as well specifically, experience higher rates of anxiety, which is, a way of saying higher worry about the future, higher rates of depression, which is really lower mood, difficulty engaging in activities that are important to people. Higher rates of sexual challenges in relationships. So these are all things that present directly as a result of the cancer. But there is, I think, also an important point, which is the idea that life doesn't stop. The rest of life, the other things that stress us as humans don't stop when prostate cancer diagnosis hits, when going through treatment. And many times, it's not necessarily the cancer itself that might be the kind of most important stressor at the moment. It's the other things going on around it that together with the cancer, then all of a sudden it becomes too much to handle. So those I would say would be the most common. I think when Dr. Crawford and I were preparing for tonight and thinking specifically about the experiences of African American men, one of the things I really wanted to bring forward was the idea of what it's like to have a disease that parents had, a father had, a brother had, a cousin had, and kind of the intergenerational experience of a disease that has an outsized impact on the African American community. And when, it's one thing to have kind of a cancer diagnosis or a diagnosis of a disease independently as a person. It's another when you've watched you struggle, others go through it, and then to sort of have that experience on your own. And oftentimes the personal experience is colored by the experience of the others. And that kind of intergenerational piece of it can be a big part of what, there can be some benefits to that, like the idea that you've seen other people cope, but there's also the challenges of knowing, how it impacted so many other people and having to carry that too.
I have another audience question. Prostate cancer is a long journey for many of us. I know people are well-meaning, but how do I deal with the constant check-ins or empathy from friends and family?
And I really, it's a question that I do hear from time to time, and a very important one because, there are both kind of well-meaning check-ins, well-meaning people who are trying to offer support, offer help. One of the challenges of that too is that the kind of most typical version of this is that people check in a lot right after somebody's diagnosed or when somebody has surgery, and then the check-ins start to maybe dwindle. So it's this idea of like, it can be an overwhelming amount of support in a period of time that it's maybe not as needed. And then, when somebody has really side effects a year later or are managing recurrent disease, that same kind of level of check-in isn't there. In addition to that, there's the experience of people saying things that aren't always as supportive as the person who is saying it intends it to be. And that's a common part of the human experience, but it's obviously more raw and more challenging when you're dealing with a serious illness and the people that you love and care about are not able to support or talk with you about what you're going through in a way that's helpful. So this is, I think, sometimes the benefit of speaking with, and it doesn't have to be a mental health professional, but clergy and others who are trained counselors and trained in some of the conversations on these topics. And not that we're immune from sometimes making comments or saying things that aren't helpful, but it can be a different experience with someone who is practiced in having these types of conversations regularly.
Okay. What I wanted to do is this. You have an audience here, you have people online, and we've just introduced another support person that people can take advantage of, the oncology social worker. But could you leave us with some high-level points that you would want us to take away? Give us what's your takeaway?
I think first I want to normalize that going through this prostate cancer experience as a patient or a family member or as a support person for somebody else is it's a challenging experience for anyone to go through. There are difficulties along the way that are some of which are common, some of which are not. But most importantly, that it's a normal part of the experience to have strong emotional reactions to having prostate cancer, knowing somebody who you love who has prostate cancer, or also surviving after treatment. As part of that, just to hopefully offer the takeaway that the goal is not to struggle with this alone. And organizations like this one that help bring people together to talk about this can make such a big difference. There are, people like myself, people like some of the other mental health professionals that were shown on the page earlier who can help with that journey. But just to know that the goal is really to help people not have to struggle with this alone and feel like they don't have somebody they can talk to. And so whether it's, somebody like myself or many of the other places to bring forward some of the struggles, just to feel like there's support out there.
Okay, so what I wanted to do is this. So Joshua's still going to be here, but we have some poll questions that we want everybody to answer. And then while you're answering, we can still talk a little bit more. What I found, and Jerry, if you can post those, what I found very interesting is this. We have this focus of the cancer, but a lot of people really didn't recognize how the mind and joy and being in a spirit, good spirit, and around supportive people can influence how even your survival. Because, when we were preparing for this, there was information out there that clearly demonstrated that prostate cancer patients who were depressed, who were under a tremendous amount of anxiety, did not live as long as those who had support and were not depressed. I mean, it was a clear difference. And so that's part of your treatment. So managing your mental health, we talked about exercise and diet, but we also talked about today about really your mental health and what are those resources that we have available. Not a lot of people knew you had folks like Josh at the hospital. Now, Dana-Farber may be different, but are there social workers at major medical centers that have same positions as yourself?
Yes, most, I would say major cancer centers will have some type of oncology social work presence or mental health support surrounding the care. So you'll hear terms like, yes, oncology social work is one. Another term that sometimes defines people like myself is what they call psychosocial oncology, which is encompassing not just usually social work, but psychologists and other team members, like some of those mentioned. And when people are coming to a major cancer center, a lot of times there will be some support. And more broadly in the healthcare setting, many hospitals have social workers involved and around. It's one of the larger areas, schools being one, hospitals being another, where there's social workers around. Some do focus a little bit more on what we call like case management.
Mm-hmm.
So there are some social workers who are more focused on helping people connect with resources, helping people get connected with care. But many are, most social workers are trained in some amount of counseling support, and to be able to offer that, it's an important part of the healthcare system.
And so after the day, would you suggest that, people be more proactive? Even though your doctor, your healthcare provider may not suggest, because of it's the stigma that may be associated with even speaking with a mental health professional. But we want to remove the stigma here. And would you suggest that people be more proactive at asking for, oncology social worker?
Yeah, absolutely. I would say if your mental health or adjusting to having a prostate cancer diagnosis is impacting your life, and you feel like talking with somebody about that it would be helpful, absolutely. And here at Dana-Farber, and in other settings as well, this is often true. Our social work team has what we call an open referral system, which means that people can go to the website or call in and self-refer for support. And the whole kind of premise behind that is that people are, even if they don't feel comfortable talking with their doctor, that they can call in and request, to speak with a social worker directly. That is an option.
Now, there was one question that popped up. Is there a cost? Or is this something that's covered by your insurance?
It's a great question. So that is going to be dependent on the specifics of the setting where you are. So for in many major cancer centers, this is considered an included. Social work is like at Dana-Farber, I'll just speak for it specifically. Social work's a free service that's available to patients. Other types of mental health professionals may bill insurance, and these types of visits are usually covered by most many health insurance. I don't want to speak for everyone, but there was a law passed a few years ago that addressed the idea of what they call mental health parity, which was intended to regulate insurance to cover mental health support in some way more comparable to general healthcare visits. So most health insurance has some coverage for mental health supports, and you can always reach out to member services to confirm what types of visits would be covered. But many settings, oncology social work will be a kind of included part of the care team. And that's true here at Dana-Farber.
All right, thank you. So I want everybody to give Josh a big hand. Online also. Thank you.
Yeah, thank you for having me.
Thank you for coming.
Oh, thank you. Thank you. Yeah.
I see we have a lot of hands on the screen too. So thank you online folks for the support. Jared, how are we? Okay. So normally afterwards, we take a poll and we want to see how we're doing and get feedback on what we can do to make ourselves better each month. The first question, did this session help you better understand how prostate cancer can impact mental health? 88% of the people who answered said yes. 12% said somewhat. So again, we're opening this kind of difficult topic, and I think a lot of people really recognize it, and that's great. The second question, do you feel more comfortable talking about feelings like anxiety, depression, or fear after attending this event? 63% said yes, 33% said somewhat, and 5% said no. So again, those numbers look good because you have to start somewhere. Okay, next question. Number 3. Did the discussion address any emotional or cultural challenges you personally face? Stigma, identity, masculinity. 69% said yes, 23% said somewhat, and 9% said no. So again, this is a difficult topic, and we would not expect that 100% of the people would understand, but we have to start somewhere. Start the dialogue somewhere, and starting it today. Question 4, did you leave the session with any strategies or tools you could use to manage emotional stress? 59% said yes, 32% said somewhat, and 9% said no. Next question. Were you satisfied with this meeting and the presentation content? 47% said very satisfied, 50% said satisfied, and 3% were dissatisfied. So we're on the right side of being satisfied. How do you rate the speaker? Excellent, 67%, good, 33%. So again, I want to give everybody give Josh a And a pause. And I wanted you to recognize that every question, he was very thoughtful about how he responded, because it's not like medicine. So well, you can have radiation, you have surgery, but when you're talking about mental health, you have to be thoughtful about how you respond to people. And so he did an excellent job. Do you feel, number 7, do you feel more confident managing survivorship challenges after this webinar? 67% said yes, 30% said somewhat, and 3% said no. How do you feel about the pace of the webinar? Just right, 100%. You attended another survivorship focused session. Would you attend another survivorship focused session? And 91% said yes, 3% said maybe, 6% said no. Would you recommend this session to others? 94% said yes. 6% said maybe, no one said no. Did the program allow adequate time for audience Q&A? 78% said yes, 22% said somewhat. And the last question, to get an idea of who is in the audience and who is online, 77% of those in attendance were prostate cancer patients, survivors. Medical professionals, 6%, advocates, 3%, clergy, 3%, and 10% other. So I want to thank everybody for coming. I want to thank Josh for taking his time in the evening to come and talk to folks about this very difficult topic. And again, I wanted to thank our sponsors. I want to thank the Dana-Farber Cancer Institute, and I want to thank our audience for being with us on another Managing Survivorship this month. Remember, we're here next month. All right, goodbye, and have a great evening.